Today I wanted to run through my final presentation and the topic I chose. I chose access to healthcare and its impacts. The main reason why I chose this, I feel like it tied back into Capstone One when we talked about the different class conflicts outlined by Marx when you compare the bourgeoisie and the proletariat. And then I felt like Haig's moral dilemma on care really fit well with this topic. First, I wanted to run through my thesis statement. The lack of access to affordable healthcare, universal healthcare, is immoral, and it really should be a right, as outlined in our Constitution. It says the right to life and well-being. The United States for-profit healthcare system challenges that right for several reasons. I think the most significant reason of that is due to the capitalistic nature a for-profit system brings, which typically impacts those in lower socioeconomic groups and then leads to poor health outcomes. I put together some statistics that were done in 2023 that really showed how big the problem is in the United States whenever it comes down to healthcare. So it kind of cascades down. You look at those who lacked healthcare altogether, 9% of Americans lacked healthcare, which is a large group, 26 million people. And then when you really dig through the layers of that even further, only 56% of Americans were probably properly insured all year. 23% were underinsured, and then 12% had a coverage gap at one point in time. And even those that had coverage, 60% of them that were surveyed said they avoided getting treatments because of the costs. 44% of Americans said they had medical or dental debt already that they were paying off. And 40% of people that were working age adults who reported a cost-related delay said that their health worsened due to that delay. So that really outlines kind of the economic aspect that ties into it, but I really wanted to talk about the sociological impacts and the psychological impacts. APA, the American Psychological Association, did a study and reported that those in urban areas had a higher stress level among Americans when thinking about healthcare, and they were more stressed about the cost of health insurance for themselves, their loved ones, and others in general. When you compare those in suburban areas, that concern is 12 percentage points higher, which really goes back into that overall class conflict that we've discussed. Just because when you look into it even deeper, the median household income in those urban areas is $21,000 lower than the median household income in the suburban areas. So the access to different resources is different whenever you look at that kind of class divide that's created due to those that live in those urban areas. So I didn't want to just outline what the problems were. I wanted to try to find solutions when discussing this project. And to me, the best way to identify solutions is to work through the blueprints that are already been outlined for us. So I compared other countries that have universal or compulsory healthcare. America is far below the average in terms of the percentage. Only 38% of Americans have compulsory insurance, where in other developed wealthy countries it's 90+%. And that results in different negative outcomes. For example, life expectancy is 4 years shorter in the United States compared to these countries. Really, the main argument when diving into this even further was that access to care and quality of care would reduce if we have universal health care. But when looking at the data that other countries have, that's just not the case. United States has 6 percentage points lower than average appointment availability, and then also the lowest count of physicians per 1,000 residents. So there is a formula that works in other countries that we can adopt. So in conclusion, the lack of universal and affordable health care really perpetuates that class divide that we've been learning about for the past 2 semesters. And we really need to look at other solutions that have already been outlined to us by other countries to help us really make sure that we can move forward and reduce some of those health outcomes that were gone over. I hope that this information was valuable and that we can make a change as a country. Thank you.